Good afternoon, everybody, and welcome. I'm Molly Altobelli, and as Jeff said, this is Acne 101. So my goals for this talk today are to go over some basic information on acne, what it is, why it happens, things you can do to help your skin have a good skincare routine, and treatments you can do for acne at home. And there are going to be some interactive questions like Jeff mentioned, so I hope that you guys will jump in and respond. It always helps to get the thought processes flowing and see where everybody is at when it comes to information on acne. And at the end, I do hope to have plenty of time to answer questions. I know there's always lots of questions about acne, so we'll get going. All right, so just briefly about myself. I joined Allegro in 2019. I came up here from Houston before that, where I did my medical school residency training, and then was in private practice for about 7 years before I joined Allegro. Love it here, love the Pacific Northwest, and really, really like working here at Allegro. I also am the mother of a 13-year-old boy, so acne is something that I deal with every day in my professional life, but also in my home life as well. And of course, I was a teenager too and went through acne just like most of us. So full disclosure, this presentation is a modified version of one I originally gave directly to a group of middle school students. So some of these slides might say your skin or things that you should do. Just understand that that is meant to be directed at your teenager or your child. Not that adults can't get acne, because we absolutely can. And a lot of the principles we're going to talk about apply to us too. But this is to help you help your teenager. So we're going to talk about what acne is, why does it happen, good skincare principles, and then some acne treatments you can do at home. So why is acne? Acne is such a bummer. I mean, it is such a drag for our teenagers, but we all have to go through it. Some of us, unfortunately, get it worse than others, but very few of us escape the teenage years without having to deal with it in some form or fashion. So why does acne happen? Well, at a very basic level, what happens is our skin pores get clogged with oil. In puberty, our hormones go into overdrive, which causes our skin to make too much of that oil. There are some skin bacteria that live on our skin that can make the acne worse. And then inevitably, genetics plays a part, as it does for so much of what's going on in our body. But you know, if your teenager has a parent or parents that had bad acne, there's a reasonable chance that they will too. And that is just one of those unalterable things we can't deal with, but thankfully we have things to help manage it that we will get over. So this is a schematic that just is a very sort of basic representation about what's happening when acne occurs in the body. So on the far left, you have a picture of a healthy skin pore. It's got a hair follicle coming out of it. That's this here. And then you have these two little glands on the side of that pore. In puberty, what happens is those hormones act on those glands to release a substance called sebum. So these are sebaceous glands. They produce sebum. In puberty, hormones tell these to make more of that substance. And what can happen is then this pore gets full of this extra sebum. And if the skin that covers the pore is open to the air at the top, if there's a little opening, the outside air reacts with the substance in the pore to make it turn that black color. And that's where we get blackheads. If the skin over the top of that pore stays closed off, then the blocked pore underneath is not exposed to the air, and you see these as whiteheads on the skin. Pimples occur when that blocked pore starts to become inflamed. So what's happening here is your body's immune system is trying to fight this thing off, and it's releasing a bunch of inflammatory molecules that are trying to fight this thing. But in the process, they're creating a bit of destruction, and so it's turning red. So that's where we see pimples on the skin. And these last two conditions here are what happens when your skin is inflamed. So this is a pimple. And then on this far right is a cyst. So here you see the inflammation is more extensive. This blocked pore has sort of burrowed down further beneath the epidermis into the actual dermal layer of the skin. And it manifests on the surface of your skin as cysts, which are sort of like really big, more significant pimples that have actually become pustules. And so if you get to this point in your skin condition, this is a situation where I would recommend that you see your physician rather than trying to manage this at home, because that's going to need a little bit more additional care. But that's the basics of what's going on with acne. All right, so now we're coming to our first audience response question. Truth or myth? Eating fried foods can cause acne. What do you guys think? Truth or myth? Give everybody a minute to respond. All right. Let's see. Okay. So looks like we've got about half and half, truth to myth. So actually, this is in fact a myth. So fried foods themselves do not cause acne. So none of the things we just talked about involved a fried food contribution. There are some things related to food and acne that we will get into in a little bit, but this is a common myth that greasy or fried or fatty foods directly cause acne. All right, next, truth or myth? Getting dirt on your face can cause acne. What do you guys think? All right, let's see what everybody thought. Okay, also again about half and half truth and myth. Interesting. You guys are doing about what the middle schoolers did, which is interesting. Yeah, so this is also a myth. Regular old dirt does not cause acne. All right, so just as important as knowing what's causing acne is understanding what's not causing it. So foods, fried food, chocolate, dairy, gluten, all kinds of things have been attributed to being responsible for acne, but actually pretty much nothing in our diet is causing the acne itself. Now I put a little asterisk there because there are some studies out there, some small studies that show a correlation between acne and food in two particular situations. One is that there were some studies that showed that people who eat a low glycemic diet tend to have less acne. A low glycemic diet is one that is low in the types of foods that your body rapidly converts to sugar. So that's things like white bread, pastries, starches, potatoes, ice cream, sort of rapid sugar sources. And again, there's no causation attributed here. There's just a correlation noted between that low glycemic diet and low acne. Probably good health reasons to be having a low glycemic diet anyway. But not enough of a evidence there to make any recommendations about changing your diet if you have acne. And then similarly, there was another bit of evidence that linked women who drink large amounts of milk to higher levels of acne, but it was not associated with other forms of dairy, cheese, yogurt. There was no effect. And again, this was just a correlation, not a causation. Nobody's entirely certain why that's the case. People postulate, but it's certainly not enough to recommend trying to drink less milk, because milk is important for other reasons for growing adolescents too, right? So regular dirt does not cause acne. The kind of dirt that's just out and about in the environment does not have the kind of bacteria in it that tend to be responsible for acne, so it's not going to hurt anything. And then another common myth, not washing your face enough can cause acne. Now you do want to wash your face regularly, and we'll talk soon about what enough is. All right, so looking really quickly at types of acne, on the left we see whiteheads. So those are those types of lesions where the pore is closed off underneath the skin, and you see those white bumps. On the right, we see classic blackheads. Those are ones that where the pore is open to the skin. Here on the left, we see pimples. You can see that area of redness around those little pus bumps. That is the inflammation that's taking place in the body. And then on the right, we see an example of a cyst. And so this is where that inflammation has gone a bit deeper. And I would actually, even be concerned about whether there was a secondary infection starting to set up here. And like I said, that's a good time to go see your doctor. Okay, truth or myth? Treating acne when you first get it can prevent acne from becoming serious. What do you think? Right, let's see what you guys thought. Okay, yeah, you guys are getting on it. So this is actually true. So acne can have some consequences. And so treating acne early on can be preventative. So what are the consequences of acne? Well, one thing, acne can lead to scarring. Those inflammatory pimples and other lesions can leave scars in their wake, little dimples in the skin. Acne can also lead to dark spots. So after the inflammation comes this condition called post-inflammatory hyperpigmentation. And that just means there's a dark spot where your skin was inflamed. So here, here, here. And these can be really hard to get rid of once they occur. Sometimes I will encounter teenagers who are reluctant to do anything about their acne. They say, it doesn't bother them cosmetically and they're not interested in treating it. And that is absolutely reasonable and totally personal choice. Just want to make sure that they understand that, there might be some consequences to not treating their acne that they could be dealing with in the future. And we want to make sure they, make informed decisions about whether they choose to treat or not treat their acne. All right, so what can we do about acne? Well, don't panic. There are things to do. And very importantly, to teach our teens, don't pop. So the two big reasons we don't want to pop those pimples, one, when we pop pimples, it leaves the skin open and susceptible to other infections. So some of that other nasty bacteria can get in our skin and cause secondary infections, and we can end up with a much worse problem than when we started. And then two, popping can lead to scarring. So anytime you traumatize the skin by breaking it in that fashion, it's more prone to not healing correctly and leading to a scar. So don't panic, don't pop. Let's talk about some things we can do to help manage our acne. All right, truth or myth? Acne will clear more quickly if you scrub your skin. All right, nice. Yeah, this is a myth. Good. Glad you guys know about this one. Yeah, so you actually need to treat your skin really gently. When it comes to washing your face, general recommendation is to wash your face twice a day, plus if you get really sweaty. Sweat can be irritating to the skin, and it can lead to that sort of pro-inflammatory state that makes you more acne prone. So get that irritant sweat off your skin if you sweat. Use warm water and a soap specific for acne, which I'll go over some examples here in a bit. And then just use your fingers. No scrubbing, no pads or exfoliators. Be gentle. You don't need any of those fancy products that the beauty industry is trying to convince you that you need. General rules for acne products. So you want to look for a cleanser for the skin specific for acne. Try to, in general, use gentle skincare products and ones that say they are alcohol-free on the label. And that is important because there are definitely some products that can irritate skin, including astringents, toners, exfoliants. These are commonly found in a lot of acne products that are sold, but really, especially for young skin, for your teenager skin, these can be a little too harsh. So just a simple acne-specific gentle skincare product is really all you need. These are some examples of cleansers that are good for acne-prone skin. And all of these are on here because they are recommended by dermatologists, but they are found just in your regular grocery store, on Amazon, at Target. They are not expensive, and they're easy to find and easy to use. So you do not need to spend a bunch of money on acne skincare products. You really don't. All right, truth or myth? Acne treatment takes time to work, so the promise of an overnight fix is just hype. What do y'all think? Is that true? Okay, yes, you guys are on top of it. That sadly is true. I wish there was an overnight fix to acne, but unfortunately, any treatment that you do for acne, any topical standard acne treatment is going to take time to work. It's going to take at least 6 weeks, maybe more. So oftentimes when I am starting a patient on a new acne regimen, I will tell them, pull out your phone, pull out your calendar, and look at 6 weeks from now and just try to understand that you need to be patient till that time, because things will work, they will get better, but you have to give them time. Acne takes a long time to form in your body, and it's going to take a long time to go away. All right, so here are some acne products that you can get over the counter, no prescription needed. Again, they're widely available in pharmacies, drugstores, and online. On the left, good spot treatment for acne is benzoyl peroxide. So this is something that you can both put on existing pimples and lesions, and that you can also have your teen put on their skin for areas where they tend to get pimples to try to prevent them in future. On the right, these daily washes that contain salicylic acid or contain benzoyl peroxide in a wash form are good to treat existing acne, and then again, also try to prevent acne in those trouble spots. So these two here at the bottom, the CeraVe and the Neutrogena, have salicylic acid. This Panoxyl is a benzoyl peroxide acne treatment wash, and this one's nice for teens who have acne on the body. This is a good way to sort of widely distribute that that product, while they're in the shower with a loofah or a brush or something similar, to get those larger areas if they have problem areas like the top of their back or their chest. A note about the benzoyl peroxide treatments, it is peroxide. It can bleach things. If you put too much of it on, it can bleach your skin. It's temporary, it's reversible, but sometimes teens go a little overboard thinking more is more, and we want to discourage that and make sure they understand to just use the smallest amount needed to cover the area. And usually that should not be any bigger than the size of a pea. But benzoyl peroxide can also, if you have it wet on your skin and it gets on, for example, a pillowcase or clothes, it can bleach it. So I recommend, if you're going to put it on at nighttime, make sure that you're just using some old, clean sheets that you don't care about, because it might bleach them a little bit. And then you wouldn't want to put this on and then immediately put clothing on afterwards, because it could potentially bleach your clothes. All right. More acne products that you can get over the counter. So adapalene, this used to be prescription only, but thank goodness now it's available without a prescription. This is really good for whiteheads and blackheads. It comes in the form of Proactive or Differin gel. You can also find generic. And it's similar to the benzoyl peroxide. You just put a small amount on the pimples, on the whiteheads and blackheads as they exist, and then you can spread it over problem areas of your skin where the acne tends to pop up. This is nice to use in conjunction with the benzoyl peroxide. They work different ways. They target different parts of the acne formation. And so, commonly I will recommend kids to do the benzoyl peroxide in the morning and then maybe do the adapalene at night. A quick word on pimple patches. These are very popular these days. Really, pimple patches only work on open wounds. So for example, if your kid couldn't resist and they popped their zit, the pimple patch can help that. It both covers it up, but it also has a wound healing gel called hydrocolloid that helps to promote healing of the skin. It does need several hours to work, so I need to leave it on kind of most of the day. It's not going to do anything for whiteheads, blackheads, cysts, anything where the skin is intact. Now, they do cover up the spots, and so if your kid wants to wear them just because they'd rather have a cute sticker visible than a pimple, that is fine. They just need to understand that it's not going to treat anything. If they want that pimple, that intact whitehead to go away, they're going to still need to do their regular acne treatment. Okay, truth or myth? If you have acne, you shouldn't use moisturizer. All right, yeah, that is a myth. Very nice. So some, people used to think understandably that if you used moisturizer, you were just adding oil to the problem, but actually, moisturizer is really important for acne. The last thing we want to do is let our skin get too dried out because that will cause our sebaceous glands to go into hyperdrive and actually produce more sebum, which can be problematic. We always want to finish off any acne treatment with moisturizer. The other thing is that some of the acne treatments, the topical ones, salicylic acid, benzoyl peroxide, et cetera, can be drying to your skin, prescription ones even more so. So you want to moisturize your skin after you apply any treatments. So pick a moisturizer that's non-comedogenic or non-pore clogging. You'll see that a lot of these are labeled as oil-free. So that's a good thing to look for in a moisturizer. And that really, this finishes off your at-home acne treatment. So it's a 3-step process. Step 1 is you clean your skin with a good acne specific wash. Step 2, you apply any medications to spots or to problem areas. Let that dry. And then step 3, you moisturize to replenish the moisture barrier on your skin. And the last important part about the moisturizer is a lot of these, you'll notice, also come with SPF. That is really important to protect your skin from the sun because, truth or myth, tanning helps clear acne. This one's a bit of a giveaway. And if any of you have ever had to go to a dermatologist or worked with a dermatologist, you will know they would like us to wear sunscreen 100% of our lives. And they would also like us to moisturize no matter what our condition is. So. All right, yeah, exactly. So tanning does not help clear acne. That is a myth. So in fact, sunscreen can be really helpful. Tanning can make acne worse. It can also worsen any post-acne hyperpigmentation, which is like the dark spots on our skin. And some acne products can make your skin extra sensitive to sun, especially the prescription ones. So loading your kid up with a moisturizer that has sunscreen in it is important. Other things you can do to help your kiddo control their acne, make sure you're washing pillowcases and sheets at least once a week. Or I should say, make sure they are washing them, have them help you with that. If your kid wears makeup, make sure they take it off before bed. Take the makeup off first, and then wash their face. Try to avoid touching their face. Kids are nervous and antsy, and they tend to touch their face a lot, but they're transferring oil and other bacteria and things onto their face when they do that. Avoid tight clothes if they have acne on their body. It can lead to pore blockage and inflammation. Caps, scarves, headbands, anything like that that's touching their face, try to wash them often if you wear them at all, because those two can contribute to pore blockage, inflammation, transferring bacteria. Keep your hair clean and out of your face as much as possible. hair has natural oils on it that can make the oil situation on the skin worse. And if all of that is not working, then of course you can absolutely book an appointment with your pediatrician, and we will be happy to help you out with next steps. All right, so that kind of wraps up my my presentation, and I would be happy to take any questions at this point.
Excellent. Thank you, Dr. Altobelli. We do have a few questions that have come in throughout the presentation. The first question is, do you recommend different products for maybe the tween versus an older adolescent and or adult?
Yeah, that's a great question. So for tweens who are just sort of starting out and have, little milder acne, I would start with just something really simple, which is like the acne specific washes, and then maybe add some spot treatments with the benzoyl peroxide. But they generally tend to not need some of the stronger prescription strength acne treatments that we do. A lot of times you can get away with just those basic ones. Older kids, we will often, if their acne has been going on for a while, we will still use some of the types of medication I talked about, but we'll layer on to them with some additional topical treatments like topical antimicrobials and stronger versions of the ones I talked about. It's a good question.
Excellent. And kind of along that same line, we have a great question. Do you recommend anything different if you just have pimples and you don't necessarily have cysts or blackheads?
Yes. So for if you don't have blackheads or cysts, if you just have pimples, I would start with the benzoyl peroxide and use like a salicylic acid face wash. Pimples, if you give it 6 weeks and that's not cutting it, then pimples specifically are often responsive to topical antibiotic ointments that you can have prescribed from your pediatrician. So that would be a next step. And the idea is we will often do like a combination product that's like benzoyl peroxide plus an antimicrobial like clindamycin. Those tend to work better on pimples specifically.
Excellent. Thank you. This is a great one. My kid feels that pimple patches help their pimples and blackheads. Is it all right for them to wear them almost every day?
Oh yeah, that's a great question. If they feel like it helps, I don't see any problem with them using it. It just makes sure that they are taking them off as soon as they're in for the night and giving their chance sort of giving their skin sort of a chance to breathe, make sure they're still washing their face twice a day. We do want to, because there is a little bit of like adhesive and stickiness on that we want to make sure we're cleaning off the skin. But no, as far as I'm aware, there's no harm to wearing them every day. If they think they're helping, that's great.
Excellent. Thank you. Another one came in. My daughter is 16 and has stopped growing, but her acne persists. I thought this meant the hormonal issues would have cleared up and the acne would be gone by now.
Yes. Oh, yes. That's a great question. And unfortunately, this does happen sometimes. So the hormones are still around and they're just not in in the same state as they were when she was going through all her rapid growth. And the other factors that are involved in acne can still be there, the oil production, the tendency toward inflammation. That might be a good time to see your pediatrician and talk about what else you might want to try to help treat her acne if it's, something that bothers her. Because occasionally it's rare, but there can be underlying conditions that can contribute to acne, different just sort of hormonal predispositions. And there are other treatments we use for older kids, girls specifically, that sometimes respond better to our prescription therapies than what you can do over the counter. So that might be a good time to chat with your pediatrician. But unfortunately, yes, for some of us, acne goes on and on into young adulthood. And for some unlucky few out there, it persists, throughout our whole lives. So if it's something that bothers you, and it bothers your teen, then I would recommend talking to your pediatrician about it.